This is Sarah Meixel, and today we're here with Dr. Scott McDougall. He is a professor at Massey University and a research veterinarian at a private veterinary practice. And today we're here at the International Mastitis Council at the international meeting for the National Mastitis Council in Milano, Italy. So thanks for being with us today, Scott.
No problem, Sarah.
And yesterday you presented to the group. Can you tell us a little bit about your talk?
Yeah, so what I was focusing on yesterday was the use and abuse, I guess, of antibiotics in the dairy industry. And, you know, as you're aware, and I'm sure everybody else is aware, there's been a lot of media around use of antibiotics in animal agriculture and concerns, particularly in the medical world, that resistance could be being created in animals because of our antibiotic use, and that could be being transferred from animals to humans. Now, the reality is that's probably not the case, that in fact the majority of resistance that's in humans is because of human prescribing and movement of bacteria and resistance genes around human populations. But having said that, as responsible users of antibiotics in the dairy industry, we do need to be aware of why we're using antibiotics, how we're using antibiotics, and be seen to be doing the right thing, and in fact do the right thing about antibiotic use. So really the key messages are that we should only use antibiotics where we need to, where we know there's a bacterial infection in the animal, that we know that the antibiotic we're about to use is actually effective. It kills that particular bug, it gets to the bacteria at the right dose for the right period of time. So what that means practically for veterinarians and producers is that we need to be able to diagnose disease correctly, to choose, understand what the disease is, to choose the right drug to use for the right period of time. But what it also means is that we need to focus on prevention. So if we can reduce the number of animals that are infected, we can reduce the amount of antibiotics we use and therefore reduce the risk that we might create antibiotic resistance. So there's a real focus on prevention of disease, so good husbandry, good management, and that means good feeding, good environment for the animals, keeping it as clean as possible. From a mastitis point of view, it means having a good milking machine, having well-trained staff, using things like teat antisepsis in a very appropriate way, and doing good diagnostics, so choosing the right cows to treat, or in fact not treat. So while we believe that antibiotic use in the dairy industry is actually relatively low relative to both humans and to other animal species, there's still a responsibility as veterinarians and as producers that we need to do the right thing. We need to ensure the health and safety of our animals, but at the same time not overuse or abuse antibiotics, because we're in it for the long haul. We want to be able to treat our animals in 10, 20 or 100 years' time. And if we do get antibiotic resistance in animals, we may be limited in what we can do. And secondly, there is a risk that the public will be concerned about antibiotic use, and we may see the regulators, governments step in and basically say, sorry, you can't use these drugs anymore. And I think there would be real animal welfare implications because we may not be able to treat animals effectively. So, good stewardship, as we call it, prudent use of antibiotics is really important. And as an industry, we do a reasonably good job now, but there's still room for improvement.
Very good. And certainly countries around the world are tightening up some of these regulations, right?
Oh, sure. We've seen a lot of change in the last 5 or 10 years. So, the Nordic countries, I guess, are the world leaders in this space. They've been quite controlled in the way they use antibiotics. We've seen a major change in the Netherlands in the last 10 years. Where they've seen about a 65% reduction in antibiotic use because of concerns about some of these resistant bacteria. And in other parts of the world, we're seeing more or less rates of change. So in our part of the world, we are seeing political or community pressure on our antibiotic use. But at the moment it's not regulated, so we're, as a veterinary profession and as farmers, trying to move forward and do a better job so that we've got the right to operate and demonstrate to the public that we really are doing the right thing.
Very good. Well, thank you so much for all the information today, Scott.
No problem, Sarah.
This is Sarah Mikesell reporting.